Welcome to Cover to Cover Book Meet. I'm your host, Roger Nichols. Our guest has been in private practice as a licensed psychologist for over 3 decades in Scottsdale, Arizona. Dr. Angela Glaser Bowers received her Ph.D. in clinical psychology from the California School of Professional Psychology in Los Angeles. And prior to that, a master's degree in clinical and community psychology from Cal State University, Fullerton. She also taught courses in behavior modification and abnormal psychology at California State University while working on her Ph.D. She is also a licensed marriage and family counselor at the time. She's received advanced training in clinical hypnosis and produced several CDs for anxiety management, surgical healing, and enhanced fertility. She's also the author of a new book, Overcoming, with the subtitle, The Remarkable Story of One Woman's Triumph Over Trauma, how the unconventional approaches by her psychologist and their bond helped her reclaim her life. We're very pleased to welcome Dr. Angela Glaser Bowers.
Hello, thanks for having me today.
The book is a remarkable account of your treatment of a very troubled woman you were able to help engage with life in a positive way. Why did you choose that patient you call Emma over the many others you've treated?
Because I think Emma represented so many challenges that so many people face, that her case was one in which she was dealing with things like severe neglect, childhood abuse, substance abuse, sexual identity disorder, PTSD, and so many other issues that I thought that if the reader could identify with even just one of those issues, then that would be a meaningful experience for them to read about her.
Okay. You are particularly open in revealing your own doubts and the fears and the struggles. Was the book difficult to write in that sense?
No, actually, the opposite. It was very easy to write. It felt almost like sort of a catharsis for me to be able to be vulnerable as a therapist, to kind of describe some of my own doubts and insecurities. And one of the things that I was hoping is that young therapists might read this book, or therapists in training, so they could understand that we also go through a lot of emotions ourselves when we're treating clients, and that that's okay.
Fantastic. You're also pretty open about the fact that in several instances you crossed professional boundaries to do things you normally wouldn't do, such as giving her a hug when she needed, inviting her to your church, introducing her to another patient who gave her a job, even doing Salvation Army volunteer work for you. Is this a case of you have to know the rules to know when to break them?
Absolutely. I mean, there are certain rules that you never break. For example, you would never engage in any sort of sexual contact with a client or financial dealings in a business with a client. But some of these other rules that are a little bit more guidelines, those I think can be pushed to certain boundaries. And so meeting my client at a church that I thought would really be helpful to her, working with her at the Salvation Army after we'd known each other for several years as a volunteer. These are sort of soft boundaries that I felt that I could cross.
Mhm. It's interesting to me about it that not only, as I mentioned earlier, examining Emma, but you examine yourself. Did you get any new insights about yourself from reviewing this?
Well, I think we're always learning about ourselves unless we're dead, right? If we're willing to think about the work that we do, whether it's being a teacher or a therapist, a physician, I mean, you name it. There's so many positions that we have where we're forced to look at ourselves and how we deal with people. And hopefully we're always learning about ourselves in whatever capacity in life that we're working or living our lives. That's part of, I think, having the willingness to be honest with ourselves and to kind of do an evaluation of, how am I showing up in this world?
Mhm. One of the things that we lay people enjoy is the chance to peek behind the curtain to see how professionals do their arcane work. And I think one of the things that was interesting to me was how you had her tell her story as if she were watching a movie to distance herself from them.
That was a technique that I specifically used at times when she was talking about some severe trauma, because if people talk about their trauma, that can sometimes re-trigger them and set them back quite a bit. And so in telling the story as if it were a movie, it distances herself enough to be able to talk about it, but not necessarily feel the level of re-traumatization.
Mhm. One of the things we talk about, of course, is the flight or fight syndrome. But a person could flee mentally just as well as physically, which is kind of something not everybody thinks about in that regard.
That's really true. That's a good point. I mean, I think that with the level of anxiety that we have in our culture right now, I think to your point, there's a lot of mental fleeing. You know, when you think about people binge watching a lot of television, kind of zoning out, I think that that might be a little bit of what you're talking about in terms of the psychological or mental fleeing that we tend to do when we're really overwhelmed or anxious.
And I found interesting the fact that you told her that she didn't have to listen to everything she thought. I thought that was really intriguing.
Yeah, that's so true. I mean, we have so many thoughts that are unproductive or that are wrong. You know,
Mhm.
we don't necessarily have to even think that we're right all the time. And so being willing to entertain the thought that we don't have to listen or believe every thought we have really sets us free emotionally. And you know, that's part of the mindfulness movement that we've heard so much about in the last few years is that we can observe our thoughts, but we don't have to attach to them, and we certainly don't have to believe them.
Mhm. You, I just mentioned in the introduction that you were very well trained in hypnotic techniques, but you didn't mention any of those in the use of this particular book.
I did not use hypnosis in this particular case, although I do use hypnosis fairly regularly for things like smoking cessation or changing in eating habits or maybe building confidence. But in her case, well, for the first probably year or so, I would not have recommended hypnosis because she needed to trust me, and I think it took so long for her to build that trust. But as great of a modality as hypnosis is, it's not necessarily fitting for every client. And so in this case, it's not one that I chose to use, but hypnosis itself can be very effective.
And then you talk about the process of diagnosis and how sometimes giving the diagnosis can be a traumatic thing.
Not only traumatic, but to the client, but also, as I mentioned in the book Overcoming, we get stuck sometimes in labeling a person. And so, as a therapist, sometimes I'm reluctant to really put a diagnosis in place because I don't want to only look through the lens of, oh, it's that diagnosis. It closes off the possibilities of looking at the client or the patient in a broader way. I know diagnosing is important, especially for insurance purposes, but I think sometimes it can actually not serve the client well to see them only through the lens of that particular diagnosis.
And particularly these days when people have access to the internet, they'll immediately look it up and catastrophize about all the things that could happen.
Exactly. And to your point earlier, when she found out that she had been diagnosed a particular diagnosis, in this case, it was bipolar. No, it was borderline and bipolar both. It really discouraged her because she thought, well, you know, how can I ever change? She read all the different criteria of that diagnosis, and it really did set her back quite a bit until I was able to really, you know, help her through that and realize that we can all, no matter what our diagnosis is, there's possibility for transformation.
Well, you mentioned that she had multiple disorders. How do you tease those apart as a psychologist? Or how much they overlap,
She,
I should ask maybe as well.
yeah, I mean, she did have multiple challenges for sure. And what I decided was I would work on some of the childhood abuse first because it was such a huge contributor to her
Mhm.
current functioning. Obviously, when a client walks through the door, the first thing that you need to do when someone's severely depressed is make an assessment about their suicidality, which I described a little bit in the book in
Mhm.
the beginning. And then it's just kind of everything is connected. So one thing leads to another. You know, we dealt with her depression quite a bit that had to do with the neglect and the abuse, but then other issues started to come up. So it's kind of like weaving one area of difficulty and one challenge in with the next. And so it's kind of an organic process that can unfold over time.
And interestingly enough, as often happens, she had a number of setbacks every time she visited her family back east, for instance, because that was the
Very
source
much
of the
so.
trauma. Yeah.
Very much so. And I think that what she didn't realize as much as maybe I wish she had is that even just being in an environment where there's been trauma, we hold so many thoughts and feelings subconsciously. So going back into the home in which the trauma occurred, even though she was prepared for it, it was just so incredibly hard for her. And yes, it set her back quite a bit. And I tried very much to convince her in the first few times that she wanted to go back, that it wasn't an ideal situation and to wait, but she, she had her own thoughts about it. And sometimes as therapists, we fantasize, wouldn't it be great if a client listened to all of our recommendations and how wonderful that would be? But that rarely happens. And so
Yeah,
then we have to deal with the fallout.
yeah. One of the things that I did not apprehend before reading your book is the subconscious mind does not realize her abuse happened 16 years ago. Everything is in the now in the subconscious. That's a new concept for me, and I think maybe for a lot of readers.
I know it's an interesting concept, and that was part of what my training in hypnosis taught me, that the subconscious mind does not have a sense of linear time as we do in our conscious mind. So what happened 10 years ago is as if it happened yesterday. And that's why sometimes things can be so incredibly powerful from our past that just completely surprises us. So, for example, one time I had a client who came to me because she was in her office and her boss came up behind her when she was at the file cabinet and put his hands on her hips. And he, that in this day and age, one wouldn't do that. This was probably about 20 years ago, but nonetheless, what that did is it triggered a memory of her father having abused her, and that memory had been completely suppressed.
Wow.
And so when that memory came up, it was as if it had just happened yesterday. And so yes, that's what happens in the subconscious mind. It's very powerful in that regard.
Fascinating, fascinating stuff. One of the other tidbits that I found interesting as well, as you said, Professor of Mine warned us not to be surprised by what they bring up in the last 5 minutes of the session.
It's invariably, it happens so regularly that in graduate school, he told us that and he said, don't be surprised because it happens all the time. And I think part of it is because usually it's such a loaded topic that people wait until the end because they know there isn't enough time to talk about it, or maybe they had shame about it and they had to work their way into it. But typically, yes, this is very, very common. When people say, oh, one more thing, by the way, there's one more thing I wanted to mention. That's when I usually have to pay really close attention because it's often something pretty deep.
Yeah. And I noticed in the book you mentioned that you started scheduling Emma for the last visit of the day just in case, because you have to go to the next client when they come in. So
I know, and because of her sensitivity to being rejected, and this ties a little bit into what would be classically termed a borderline personality disorder. Um, any slight can be very hurtful to a client. So if she had opened up to me about something in the last 5 or 10 minutes of the therapy, and then I couldn't deal with it, that could be taken as something very personal by her. And so I deliberately, yes, tried to make her appointments at the very end so that A, if we needed to run over, we could, and B, that she always got what she needed in each session and wasn't left hanging.
sometimes this is a question I've always wanted to ask a psychologist. How do you know if you're doing the right thing? What gives you the feedback that says this is working?
Couple things. One is when the clients return week after week or month after month. If I had clients that I would see once or twice and they didn't come back, then that would alert me, hey, something's not working.
Mhm.
So their willingness to stick in therapy together with me, also intuitively, I think we have feelings about what's going on and if we're moving in the right direction. And often I'll ask, is this productive? Are we making progress? Is this what you thought this would be? How did you feel about our session today? So, being willing to engage in that process of asking if we're making headway, I think is really important. And sometimes I've been in situations where I really felt like perhaps we weren't making the progress that we should from my perspective, only to learn that the client thought it was going very well. So sometimes we come into sessions with different expectations. And so what might seem to me like therapy that's kind of just going very, very slowly, the client has been happy with. So there are many different ways to kind of check in and see how it's going.
One of the things about psychology is that it's an evolving science all the time. Um, DSM-4 and DSM-5 have some significant differences between them. And how does that affect you in your practice?
The DSM doesn't affect me much at all, but what does affect me is the research on what works and what doesn't.
Mhm.
You know, when I was in graduate school, there was we had just come out of the tradition of analytic therapy, Freudian analytic therapy, and we were moving into behavioral therapy. And so what's interesting there is I'm just reading a book right now by Bruno Bettelheim. Have you ever heard of him?
That's a, you know,
He was a psychologist years and years ago who was running a school for children who were severely psychotic. And back in those days, the main paradigm was psychoanalytic, which in my opinion does not work that well. We have so many modalities now that are very effective. And so I think for me, what's more important than what's going on in the DSM, because that's all about diagnostics, it has nothing to do with treatment. It's more about where's the research going. And so
mhm.
we're learning new techniques all the time. The latest research is in what's called energy psychology, and how energy psychology, whether it's EMDR, which is rapid eye movement desensitization, or EFT, which is called emotional freedom technique, how these things can really change people very, very quickly that have had traumas. Are you familiar with either one of those
No, I'm
techniques?
not. That sounds fascinating, though.
And they're based really on the body. And so the EFT, for example, is basically is based on tapping the meridian points of the body, the same points that are involved in acupuncture. And there have been probably over 100 really good randomized clinical trials now on the efficacy of the tapping. And it's like I'm demonstrating it right now. It's
Mhm.
tapping on the face, on the collarbone, different tapping points. And the EMDR has to do with rapid eye movements where the eyes move back and forth very rapidly while the client's telling their trauma. And then the therapist is asking very specific questions about their trauma. And often that can be a quick method to heal PTSD. And so these are
Interesting.
all modalities that are that are fairly new, like within the last 15, 20 years, and there's constantly new things happening. So I think that's a whole lot more interesting than the DSM.
Okay, appreciate. One of the things you also mentioned is you talk about the scrutiny you face from your patients. So you are the star and the only show in town and the only person up on the screen, and you're inspected very minutely, and how you have to think about that and deal with that.
Well, especially with clients like Emma in the book Overcoming, because they're constantly looking for ways that they can't trust you. And so when someone comes into my practice that has those, what might be considered borderline tendencies, I have to be extremely vigilant to make sure that I'm consistent and that I'm as trustworthy as I can be, because every small little thing can have a huge impact on them. And there's an example I gave in the book about how I didn't answer my phone. I had my secretary take a message,
Yes.
and that to most people would be fine. But to her, it was, she thought I was rejecting her and that I didn't think she was important. And, it became a huge issue that normally shouldn't be. But that would be an example of what we're talking about.
Well, you also point out that you, as a result of this, you have to pay very close attention to yourself and be aware all the time, which could be positive in the way you do your treatment.
I think so. And not only that, but it's also positive in terms of how I live my life, right? Having that sense of mindfulness and awareness, I think makes us a more sensitive person in terms of whether I'm dealing with clients or my friends or family members, having that level of awareness of how are my actions and my words impacting others.
We should all be so mindful, and that's probably a good lesson for all of us at
I
this
think
point.
so. Right.
Um, I have to ask, has Emma seen the book?
She has. So initially, I wrote the book in a very short time. It was only a couple months, and then it took a whole year for me to get permission. I mean, I asked for permission from the get-go. She said yes. But then after I wrote the book, she had to read it, and it took her a whole year to read the book.
Mm,
It was a tough process for her to read it, but she was very supportive of it, gave me permission, and has been very supportive since then, and has been curious to know about how the book's going. And so, yeah, but it was tough at first, as you can imagine.
yeah, and I'm assuming we can report that she's doing okay these days.
She's doing great,
Uh,
better than okay. Mhm.
great to hear that indeed. The other thing I wanted to talk about is how the book is structured. You have unusual access to all these letters and emails and whatnot she wrote you, which lets you see inside her mind as well as this is going on.
I know that's what made this book, I think, so special is because the story is told by me, but also by her. And what was also interesting was that she was able to discuss in her writing some of her thoughts about therapy, which we often don't get when a therapist writes a book. They, tell the story from only their vantage point. So what made this so special is that it's two voices really that describe her story.
Yeah. So it's really been a fascinating journey. What do you hope when people close the book that they take away from it?
I hope that people will take away a sense of inspiration, a sense of, hey, if she can do this, so can I. I hope that people will take away the understanding that we are very resilient and that we can recover from most traumas. We have to work hard and, if we're in therapy, have a good fit with the therapist. But I think it's mainly the idea of hopefulness and the power of forgiveness. One of the main themes of this book is Emma's willingness to work on forgiveness. And when she did that, she really set herself free. And so I think that's a very important lesson of this book as well.
For those of us who greatly enjoy the book, will there be another from another subject?
I hope so. I right now I'm still in the process of talking about this book and working on a few other projects, but I think down the road there'll be another one. I
Or
have so many interesting stories to tell, that's for sure.
oh, that's and some of us would be fascinated to hear all of those. So, in fact, maybe there's a book of short stories about that.
You know
About
what? I was thinking exactly that. There are so many client stories that would be great to tell, but maybe in a shorter version. So yes, you and I are on the same page on that one.
all right, we'll be looking forward to that. But in the
Thank you.
meantime, if people wanted to know more or contact you, you have a web page. You've got
I do. I have a website called artoftransformation.com. And on that website, by the way, are some recordings that people can listen to for anxiety, for meditation, for guided imagery. And so those are all free that they can download off of the website.
oh, I'm so glad I asked you about that. It's extra bonus for all of our listeners today. Our
Yes.
guest today is Dr. Angela Glaser Bowers. The book is Overcoming, is highly recommended. Thank you so much for your time. I do appreciate that.
Thank you. It was a pleasure. Take care and Happy New Year.